point, if you are still eating, please continue by all means. But I wanted to expedite the schedule and get everybody activated. Hope you enjoyed your month off, the month of July, and get us back into the groove here and meeting in August. And looking forward to a good September meeting and then an October meeting where we'll have our annual meeting out at Lake Tobosaki. And I understand staff is hard on those arrangements. It's going to be a good time had by all. Kim tells me we do have a quorum of members here tonight. Therefore, I'd like to ask that we stand and have a pledge of allegiance. And I'll ask Jim Tackett to give us an invitation after we pledge allegiance. So would you stand as you're able to join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. Dear Father, we thank you for this day that you've given us. We thank you for this great country, our great state. We thank you for all the communities that are represented here tonight. Be with us as we make decisions that affect our communities and our constituents. We thank you for the food that was provided tonight. We thank you for the hands that prepared it. We ask you to bless it to our bodies and us to your service. In your name we pray. Amen. Amen. Please be seated. We have some folks with us that I'd like to recognize. Tanya Moe with the DCA, our regional rep, is here with us tonight. But I don't think any of our congressional representatives are represented here. So we'll miss them and we should pass along minutes of the meeting. Are there any other guests that have joined us tonight? Anybody here that we need to recognize and welcome? Yes? Looks like this is home folks.
John L. Menifee with Solar Time USA LLC. Thank you.
I'm glad you're here. Any other guests? All right, thank you very much. Let me move on at this point in time now. And Laura, I understand we've got a couple of new staff members that you would like to introduce to.
We do. You had a little bio about both Will and Marissa in your packet, but just wanted to put a face and a name and a bio together. So I think, Marissa, did you start first before Will? By like a day. So Marissa Jackson has joined us. She's in our public administration department and is getting all settled and relocated to Macon. And so if you're out in the community, she's already doing some good work. She's working over in Hawkinsville, doing some work on a grant there, and has lots of other projects, so you'll be seeing her out and about. And then Will Cowart. Will has joined our team in July as a GIS analyst. Comes to us. Thankfully, he had a break in service before he came to work for us. He used to work with the Macon Water Authority for about 10 years, and then he went private sector, so we did not steal him away from anyone locally. We stole him away from the private sector, but Macon native, we're real happy to have him here and to bring that expertise. So he'll be interacting with both Marissa and Will over your tenure with us, and just wanted to introduce you.
Excellent. Marissa and Will, look forward to working with you. Glad you're here with us tonight. Thank you very much. One sad note, unfortunately, we learned earlier this week that Butch Hall was stepping down from his position as sole commissioner of Pulaski County effective August the 6th. So he has already stepped down. He did that, I understand, to spend more time with his wife, who is critically ill. And I understand he's one of the principal caretakers for her. So he stepped down as the sole commissioner. I understand that the probate judge, Jeff Jones, has stepped in and will be the interim sole commissioner for Pulaski County until they have a special election in November. Butch, as you know, had a long affiliation with the regional commission and served in a number of capacities. We always miss his dry smile and subtle sense of humor. And I hope we can get him back on a time or two in the future. But the staff will prepare a resolution
we hope to keep him in our thoughts and prayers. Also, another development since our last meeting in June, I have selected Grady Clements of Houston County to serve as president of the Aging Advisory Council. And Mr. Clements, many of you know, is a former regional commission council member. He was on the Warner Robins City Council and is retired from Robins Air Force Base. The Aging Advisory Council is a required stakeholder group of older adults and community-based service providers that offer input and outreach, and Grady has been president of that and is going to agree to continue, and I appreciate him doing that. That brings us now to a point that a lot of us are looking forward to, and that's the guest speaker for tonight. And I'm going to call on Julie Hall to give an introduction to our speaker tonight. Julie, can you come introduce our speaker?
So, good evening, and I'm pleased to introduce Abby Thomas tonight. You have her biography in your packet, and I will tell you, if you take a minute to read it, you'll be quite impressed with her. Let me tell you just a little bit of what I know of Abby. Abby and I go back quite a few years. If y'all remember, years and years ago, I used to be the excellence program in the office, and at that time, Abby worked with me in that program. So we have a long-standing relationship. Abby also works for the older adults cabinet, which the commissioner, Abby, thinks I should sit on. That's right. Abby is a very kind person. She is not just a good manager for the Division of Aging Services. She also listens to us as area agencies on aging. She has, since she took over 2 years ago, stood up on meeting occasion and asked for something that we asked for, knowing that she was probably still going to get a little bit of feedback, but she was more than willing to give it a try. There is no one who is a better fit for that position than Abby Thomas. And so with that, I'll turn it over.
Oh my goodness. Wow, that was super nice. Well, it's great to be here with y'all tonight, and as I've said, this is a meal far superior than I would get home with dinosaur chicken nuggets and princess mac and cheese, which is kind of the phase of life that we're in at home. But as Julie said, I'm Abby Cox, and I'm the director for Georgia's Division of Aging Service. And before I get into some of the updates that I thought might be interesting to share tonight, I thought maybe just a little bit of a context of who we are. Perhaps y'all already know, but it kind of helps set the stage, I feel like. So I'm located within the Department of Human Services, and one of the divisions in the Department of Human Services is the Division of Aging. And so that is what I head up. And so we administer programs that come in either by state funds and or federal funds. But we do not directly administer the majority of those programs. Instead, we contract out with 12 area agencies on aging. The exception to that is Adult Protective Services and our Public Guardianship Office. Those are the 2 programs that we do directly administer. So those state employees are located within our state offices across the state. But the lion's share of our work is tied very closely with our area agencies on aging. So the relationships that we have with them are critical. And you have the greatest leader here with Julie Hall. She is not only an individual who brings a lot of thought and perspective when it comes to policy changes and advancing our programs, she's also the head of G4A, the Georgia Association for Area Agencies on Aging. So a tremendous leader here, and you should all feel very proud about that. Within the Department of Human Services, our vision is Stronger Families for a Stronger Georgia. Within the department, we've got the other divisions are the Division for Family and Children Services, DFACS. We also have Child Support Services, and then some support offices. So oftentimes people say, how does aging fit in? There's a lot of kids stuff. Well, that's true, but a lot of our work does overlap, and so where we all connect is trying to create stronger families for a stronger Georgia. Within aging, Julie had kind of mentioned our work to keep people in their homes and their communities as long as we can. And that is our vision, living longer, living safely, living well, and trying to help those individuals identify where they want to age and place and help make that happen where we can. I thought tonight it might be interesting to talk a little bit about a very exciting initiative that we are doing alongside Emory University. So in the state fiscal year 18 budget, the legislature and governor put in a little over $4 million to our department to administer what's called the Georgia Alzheimer's Project. If you look in the line item, there's been a name change since, and it's now Georgia Memory Net. The goal of this initiative is early detection and diagnosis of Alzheimer's and related dementias. If we can catch it early, there's so many more options that we've got at our disposal. There's no cure for Alzheimer's yet, but what we can do is help individuals and their caregivers plan for what the course might look like, help honor that individual's wishes, help get them the best care possible so that it's not just a doom and gloom sentence and whenever that diagnosis is given. So the way that we're going to make this happen, as prescribed by the funding, is we are opening up 5 memory assessment clinics across the state. And for anybody who has understood what it is like to work within the confines of state government and contracting, it's not an easy feat in one fiscal year to get 5 sites up and running, contracts signed, and all that goes along with it. So we are very proud to say that in the state fiscal year 18, we were able to not only identify all 5 memory assessment clinics, but get them up and going. So that's one component to it. Another component to this project is we gotta start getting people, physicians, to start looking for signs of cognitive impairment. And one easy way to do this is at the Medicare well visit, there is a cognitive screening that your primary care physician can do. There's a very high reimbursement rate attached to this cognitive screening, but a lot of physicians don't know about it. It's a newer screening. So we've been doing a big education campaign to educate primary care physicians and nurses about this cognitive assessment. And oftentimes what we would hear, if a primary care physician saw something that didn't look right, they didn't know where to go with it. And so oftentimes they just wouldn't give the diagnosis. Now, what we are giving them are these 5 memory assessment clinics where you don't have to make a diagnosis. Rather, what you do, if you see something that looks not quite right, you refer out to your local memory assessment clinic where a diagnosis is made. And the diagnosis at all these 5 memory assessment clinics is done the exact same way. So for data collection purposes that we need to track so closely, a diagnosis that is done in Waycross is the same way that a diagnosis is made in Macon. So we feel very proud about that. And then really what sets Georgia apart from the entire nation and what we are doing is at the point in time that a diagnosis is made, we're going to wrap that individual and or their care partner around supportive services. So you don't leave that office feeling like your world's turned upside down. We're gonna help you out. We're gonna follow you. We're gonna connect you to services, and we're gonna continue to check in on you. So we've got some slides here that kind of demonstrates exactly what I was talking about. That is exactly what we just went through. But I want to tell you about those 5 sites. So in the first year, what we did is we wanted to have a very transparent process. This is something that the legislature is very proud of, as they should be. So we had a lot of individuals that were saying, I want a memory assessment clinic in my area. The way that we went about it this year was attaching those memory assessment clinics. They have to be attached to an academic institution. For contracting purposes, that's a lot easier. These clinics already have the technology that we need for imaging and things like that. So we had to have clinics that were ready to get up and going. So the first one that opened up was in Augusta University. That one should be a surprise to nobody with the medical college there. Then the second one to open was Atlanta, and I say was. They're still having some contracting issues, so they're not quite seeing patients yet. But in Atlanta, it's attached to Grady and Morehouse. And then the third one, I should feel very proud, is right here in Macon, attached to Navicent. And then the fourth one is Columbus, and the 5th one is Albany. So you can see that we're doing a better job of getting south, but there's a lot of the state here that we need to cover. And so we're gonna have to demonstrate the effectiveness of these memory assessment clinics and see if the legislature is willing to consider adding more of those. So the model goes, you have to be referred to these memory assessment clinics from your primary care physician. I can't just go to the memory assessment clinic and say, I think I need to be screened. It has to come through the primary care physician. So that primary care physician makes the referral to the memory assessment clinic where the individual is given the diagnostic protocol and then, if appropriate, given a diagnosis and then wrapped around with supportive services. That individual then continues to be followed by their primary care physician. So they go right back to them. So for the supportive services component, that piece is going to shake out to be very different from all 5 locations across the state. Julie has a very aggressive model that I would love to see replicated more. And that one is that she's going to go and actually physically be at the memory assessment clinic, assessing these individuals for their needs, wrapping them around services right there. Not all of the memory assessment clinics have the physical space for our Aging and Disability Resource Connection to be there. Julie's fortunate in that regard, but it's going to be very interesting to watch the data that comes out of Macon to see just how effective their approach is in doing the supportive services component. So this is just kind of a model that lays out exactly what we just talked about. And then we can't do this work alone. Emory can't do it alone, the department can't do it alone. And so for what's listed here are some of our community resources. So we've got the Alzheimer's Association, who's going to be doing a lot of assistance with individuals and care partners. We also have the Rosalynn Carter Institute for Caregiving, really focusing on those caregiver needs. What research tells us is that our caregivers oftentimes go downhill faster than the person for whom they're providing care. So we really have got to focus on our caregivers as we pursue this initiative. We've got our area agencies on aging across the state, and then I think that gets all of them. And so then for state fiscal year 19, what we're going to be doing, now that we have all the 5 clinics identified and they're up and beginning to see them, what we can do is refine that workflow that we've identified for how all of this will go. We know that there are going to be nuances in every area that need to be looked at and tweaked so that they best fit the needs of the individuals who are coming through them. We also want to make sure that we have input from the local area into how well these memory assessment clinics are being received. What can we do to improve them? And that decision for what goes on in Macon doesn't need to be made in Atlanta. That needs to be made by people who are here, who are experiencing the memory assessment clinics and those who can help us find unique needs for this particular area. We'll be ready in this fiscal year to start doing a lot of marketing and messaging about our memory assessment clinics. We couldn't do it last year because we weren't ready for patients to begin coming through. So that's what we'll begin doing in state fiscal year 19. And then the IT infrastructure. Good grief, this has been a huge lift. It's a huge lift enough just to, to get IT infrastructures in place. But when you add big hospital systems into the mix, it becomes even more difficult. But we're working with a great contractor called Informatics, who's helping us identify how we're going to be able to capture the data that we need to capture and move forward. So we'll be able to implement that in state fiscal year 19. So that was one thing that I wanted to talk about, and very quickly. The other thing that I want to talk to you about is our state plan on aging. So every 4 years, we are required to send a state plan on aging to our federal partners, to the Administration for Community Living. And in the process of developing that state plan, we don't just say, here are the things that we're going to be doing. No, what we have to do is get out and hear what the needs are in each area and let that help inform the way that we develop our state plan. So that is where we are right now with our state plan. We're out and we are doing our public hearings across the state, And again, that will help inform how we write our state plan that's coming up. So we have done 10 of our 12 public hearings. In the past, we did not have public hearings in every part of the state. This is my first time being a part of the process, and I felt very strongly that every planning and service area needed to have a public hearing because we all know transportation is a problem, and I didn't want anybody to feel like they didn't have an opportunity to have their voice heard. So we've done the very onerous task of getting out across the state and putting these on, but the input has been phenomenal. The turnout for these public hearings has been phenomenal, which lets me know people are really interested in having a voice and how we move forward and helping to decide what our priorities are going to be. So what this map just depicts in the green, these are the areas where we had a public hearing, and the areas in the yellow are the ones that we still have left to do. Although Athens had theirs today, and I understand had to turn people away because they just were at capacity. So a great problem to have, but there were voices that weren't able to be heard. So in these public hearings, what we are letting individuals know is that, like I said, that the state plan informs the way that we prioritize our activities. And we demonstrate how the last state plan worked, that their voices help inform the priorities that we have, and a report out on the progress of those activities. And then we have come to see that there are really 10 key activities that people bring up year over year. And so we ask people, while they're at these public hearings, they get these pretty cool little voting devices. They get to vote on the priorities that resonate with them the most. And so here has been what is really cool. It may be hard to read this. Aging in place is our #1 issue right now.
Wow.
That means as we go out across the state, 9 of our, well, we've only done 10 public hearings at the time this data was captured. 9 of them said aging in place was #1. That's a change from what we had in the last years. Access to information and assistance, exactly the work that's being done right here with our area agency on aging, the Aging Disability Resource Connection. That's what they help to do. But people they need that information, they want more of it. A lot of people don't know about us, so we need to do a better job of informing people about our Aging and Disability Resource Connection. And then another piece that is, this one is a new one to us, physical, emotional, and behavioral health. You know, a lot of what is included in here is the Alzheimer's and related dementias, but we are seeing, because we serve aging and disabilities, we are seeing more and more individuals who are younger, but they have a behavioral health diagnosis. We gotta learn to adjust as an aging network to be able to meet their needs, because this is a big issue that obviously our areas across the state are identifying as a big need. Aging in place, a lot of what is encompassed in this is housing. You know, the housing is a big issue that we've got. In the past cycle, housing and transportation were our #1 and #2 issues. That doesn't surprise me at all. It doesn't surprise me that transportation's up there. What surprises me is the physical, emotional, and behavioral health, because we haven't seen that one before. So we're seeing some new trends going into this state plan cycle. So it will be exciting to formulate some activities that speak to the needs that are being expressed in our public hearings. And so as we look to 2019, now that we're in this new fiscal year, we've got a lot of work that we're targeting right now. One of them is around adult protective services. The work that we're doing there is I'm very, very proud of. We are going to be certifying every single one of our APS case managers. When I tell you all the work that they do every day, it's dangerous, it's difficult, no one case looks alike. I have to rest assured that I'm giving them all the training that I can. And I need for them to demonstrate that they understand all this training that we're giving to them, because when they get out there, these are very difficult situations that we're putting them in. We will be the only state in the nation right now that certifies all APS caseworkers. I feel like this also helps as we get out. We work closer and closer with law enforcement and with our probate courts to have this certified, I'm a certified case manager, resonates in a way that maybe, anybody who just came off the street who we hired and is doing our difficult work, maybe it doesn't, the certification resonates more. So I'm very proud of that work that we're doing. The older adults cabinet that Julie mentioned, this has been a very exciting endeavor, and this cabinet is chaired by First Lady Sandra Deal and my commissioner, Robin Crittenden. And as a cabinet, there are individuals who are commissioners of state agencies, of large organizations that serve older adults and individuals on a statewide capacity. And none of this is mind-blowing, but to get everybody around the table to talk about the work that we do has been tremendous. We're stepping over each other left and right, and so this is helping us identify that how we can work better together to stay in our lane so that we can reach the number of people that need our help out there. And so in state fiscal year 18, the older adults cabinet identified 3 priorities, and those were access to services, workforce development, and abuse, neglect, and exploitation of older adults and individuals with disabilities. So in this fiscal year, they have identified key activities that they would like to pursue as a cabinet. And those are some activities around abuse, neglect, and exploitation, specifically around the work that we do when it comes to unlicensed personal care homes. We're seeing them popping up like crazy. And oftentimes these unlicensed personal care homes do it because of the benefits for the individuals. And the individuals are living in a basement. They might have a hole to use the restroom in. They might be thrown a bologna sandwich. We're going to shut them down. And we are working very aggressively with the Georgia Bureau of Investigations and law enforcement to do that. But that's meant some code changes to the maximum penalties that we can pursue. That's meant some code changes to data that we can be sharing. So we're doing a lot of really good work in this area, and we hope as a cabinet we can continue to move that forward. Another key activity that the cabinet's going to be pursuing is more work into this mental health arena. How can we work closer together? And I don't know what that activity will be. I think that this will evolve more as we move as a cabinet. And then the last one is around access to transportation for older adults. So it'll be interesting. I would love to come back and report on how we're moving forward with those activities and what they look like. But I just know at this point, those are the key areas that have been identified. And the last thing I want to tell you about is our Listen and Learn tour. So last year, the commissioner and I and the director for Child Support Services got out around the state and traveled to see all of our offices, all of our area agencies on aging, and sit down and really listen. There's no agenda attached to it. We wanted to listen. We wanted to hear what's going well, what's not going well. And this was a critical time to do this. We implemented a new information, a data system, ironically called Harmony, but it was not bringing harmony to anybody who was using it. And the input that we got was really incredible, because what it allowed us to do is really push back on the vendor and say, this is not going well. And we got a plan B. We're gonna be getting out of this if you can't address it. And all of a sudden, we're getting a lot of response, which is a good thing. But we wouldn't have had that opportunity, maybe to hear all of that input, had we not just sat down with people. Not try to convince you that this is the right system, or that the way that we're doing things is right, the way that policy written is right. No, I just want to listen. So that was a great opportunity last year, and we're going to continue to build on that as we move forward. But what I want you all to know is that what is so important to me is getting out in the community, and I really appreciate the opportunity to come here tonight, but to listen. And with that, I'd like to open it up if y'all have any questions for me, anything I can do for you.
Hey, what a great presentation. All these questions from anybody, we all know, I think, that the state is aging and increasing. Have you got any demographic numbers or trends or anything like that that you didn't touch on tonight?
Yep.
But about how fast we're
Yeah, so this is very interesting.
aging?
We are an aging state. And what's interesting is we are seeing a lot of people from Florida coming here for various reasons. We got a lot of people, you know, just because we've got warmer temperatures that come in down south. But we are one of the fastest growing 85 plus populations in the nation, which means 85 plus. Yeah, and we've got I don't remember what the demographics are, for 65 plus, but across the state, we are seeing increases in some areas more than others. But what that does for us at the federal level, we're recognized as a fast-growing state. So it affords us the opportunity to draw down more funds because we're serving more people. We just have to serve them in the right way.
Jim, I saw your hand.
Yeah,
Question?
can you elaborate? There were 3 items from the cabinet.
Yeah.
Workforce development. I was real curious. That seems counterintuitive, but I know it's going to make sense after you
Yeah,
explain.
this is a really good one. So this is about getting enough people to retain in the workforce. So we've got a big retention problem, especially the example that comes up a lot is in home health, that people are just, you know, cycling from one agency to the next. We've got to be able to retain the individuals who are working and serving older adults in whatever capacity that might be. We also have to attract new workers, but we have fewer, and the demographics tell us we've got fewer people coming up to help this big baby boomer population that's going to be here. So we got to look at our workforce and figure out how we can work smarter, retain the right people. And another component of that is giving them the right training. You know, it's a difficult population when you're working with individuals with dementia. So we need to make sure that we're giving them the tools that they need to be able to serve that demographic too.
Thank you.
Yeah, thank
Other
you.
question?
Can you speak a little more to the activities you'll be pursuing related to senior hunger?
Oh, that's a great question, and I should have put that on here. We are doing a lot with senior hunger, and this is another area that we feel very excited about in the state. We're the first state to write a state plan on senior hunger, and this issue is one that, as I go around the country and meet with my peers, an issue that a lot of states are really focused on. Georgia has a really bad ranking. We rank 9th in terms of senior hunger. This is a top 10 list that we don't want to be a part of. And a lot of that is because we're such a rural state. So when we get out to our rural areas, for an individual to have access to fresh fruits and vegetables, when transportation is a problem, you know, it's not easy at all. So we're really trying to focus on finding local solutions to address senior hunger. So an example of that, we've had 2 senior hunger summits. At our last one, we had a group of farmers from the Albany area come, and they talked to us about gleaning. Well, I can promise you in the past, farmers would have never been interested in coming to an aging conference. So that is one thing that I love. It's a partner that we have not traditionally tried to recruit to work with us. And then the whole gleaning notion. I mean, this is good food that was just going to go bad, but it's just not pretty enough to sell to the grocery stores. So could we go out to your fields and pick this tomato that looks ugly, but I can give it to somebody and make sure that they're getting the nutrition that they need? So that's some of the work. Another part of the work is looking at our congregate meal sites and looking, oftentimes we found that they're over ordering their food. And so helping them with their systems and finding the way that they can maximize their dollars and serve more people at a congregate, a senior center.
Other question? If not, how about a warm round of applause? We appreciate you driving down to be with us tonight and give us a very informative presentation, and thank you for what you're doing in the Division of Aging Service.
Thank you.
We appreciate it. Standard order of business, the minutes have been prepared and distributed, and they should be in your packet. And we'll email to you as well. Any changes or corrections, if not, can I get a motion to approve the minutes as presented? Got a motion and a second?
Second.
All in favor of approving the minutes, signify by saying aye. Aye. Opposed, no. The ayes have it, and the minutes are approved. Old business, I guess part of no way to meet last month, but there is no old business. Neither that, we took care of it back in May. So new business, we'll move along. And first, we've got some local assistance, so request, and Kimberly Love will come and give those to us.
requests have been received since the June meeting, and staff time is available to assist with each of these requests. For Baldwin County, the assistance is preparing a 2018 Justice Assistance Grant. For Crawford County, applying for a firefighter's equipment grant. The City of Forsyth, assistance with the procurement of architectural services and grant writing related to a potential workforce development center. And for the City of Hawkinsville, assistance with applying for an EDGE grant. There are a few highlights I'd like to give from the regions, while I have your attention real quick. Our Technology Services Department deployed a new refreshed website for the City of Cary. Each county receives $30,305 from the Firehouse Subs Foundation to purchase extrication equipment. The town of Danville received $23,207 from the Assistance to Firefighters Grant to purchase radios and turnout gear. And Putnam County Development Authority received a One Georgia Equity Grant in the amount of $446,552 to assist with the site preparation and infrastructure improvements in the Eatonton Putnam Industrial Park. And while we're talking about senior hunger lawyer, our area agency on aging has been administering the seniors farmers market nutrition program. And since the beginning, we have provided vouchers for 855 seniors in Middle Georgia, which equates to each senior getting $20 in vouchers to purchase locally grown produce. So that is over $17,000 that we have been able to provide to our seniors in Middle Georgia.
Wow.
And just one more blurb. The Georgia Academy for Economic Development is getting ready to kick off, so there's flyers out on the rail pickers and name tags on that table. If anyone's interested in attending, please see Tanya.
Great. All right, you've heard Kimberly's report. Are there any questions of her about anything that she reported on? If not, can I get a motion to approve the local assistance request, Baldwin County, Crawford County, Hawkinsville, and Forsyth? Got a motion second?
Second.
Further discussion? Hearing none, all in favor of approving the local assistance request, signify by saying aye.
Aye.
Opposed, no. The ayes have it, and the local assistance request are approved. We were talking earlier about transportation and trying to get folks around, and we have a Federal Transit Administration Section 5310 application. It's very complex and hard to understand, but nobody better to explain it to us than our own back car.
I don't know about that. As you recall, back in February, we actually did a resolution to prepare the application for 5310 for our coordinated transportation program for all of our counties except for Putnam County. They at the time were not part of the aging, providing transportation to aging clients. They have requested to kind of get back into the program. They used to be in it years ago, so they kind of want to get back into it now. So this resolution just kind of amends the application that we did back in February to add Putnam County to the 5310 program so that they can begin to start transporting some of the aging clients to and from where they need to get to, doctors, grocery stores, senior centers, and all those good things that the senior citizens get out to. So anybody has any questions about the resolution, be glad to answer.
Right, now, I told you he could explain it to you. Any questions tonight about the 5310 modification of the old application that we submitted to provide services for Putnam County? Any questions about that? If not, can I get a motion to approve the submission of the modification for 5310? Got a motion second? Got a motion and a second. Further discussion? Hearing none, all in favor of submission of the resolution, signify by saying aye.
Aye.
Opposed, no. The ayes have it, and that proceed with 5310, and I'll sign it, give the law momentarily. That's correct. I think while you're up here, you might just well give us the quarterly financial report and tell us how to do it. Okay?
Thank you. You should all have a copy of the fourth quarter FY18 budget actual analysis. This is through the end of the fiscal year, June 30th of 18. These are not however, the final, end of the year numbers. We're still looking with things. We get some invoices out and all those things. So these are, again, not the final numbers, but they're pretty close to being the final numbers. Local revenues, as they stand right now, they're actually at 140% Again, a large part of that is the GSBL money that came in upon their dissolution. So if you kind of back that out, local revenues are actually about 80%. The rest of the other 20% is mainly, there are other local contracts that are out and have been billed. We're just waiting collection on those invoices. So pretty much all of the local contracts have been administered and have now been billed. We're just kind of waiting to receive payment on those. State revenues are at 70% through June 30th. Again, there's a lot of billings that are outstanding with the state that we sent and submitted to the state. We're just still awaiting their payment on those invoices. We also have some additional MAP 21 and DCHP for services billing that will be taking place as well. So we expect that they will be much closer to 100% of state budget revenues once we get all the collections in. Federal revenues are at 76% of budget revenues through June 30th. Again, there's a large amount of receivables out there with various federal agencies for the invoices that we have billed out and just not collected yet. One of the ones that's a little bit less than where we thought there should be at the end of the fiscal year is OEA. It's only at 71%. We've done some additional billings in the fourth quarter of 18 that are, again, we're waiting for collection on. So that's going to be one that comes in pretty close to what we had budgeted. Expenditures are 93% through June 30th. A couple of items there with the expenses. The contract services are actually only at 66%, so they're a little bit behind, but a large part of that is the OEA contract that I just talked about. Some of those invoices just haven't been received yet, so we expect that there will be some additional contract services invoices that will get that closer, that number much closer to what we thought we had budgeted for. And the other one I'll point out is workforce tuition and fees are actually at 123%. So we have a lot more activity in the workforce program with paying out tuition and fees to our workforce participants than we had thought. The good news is that there's additional funding in the workforce that covers that, so that money's not coming out of our pocket or anything. That's additional workforce money that is available to cover that additional expenses. If anybody has any questions, one thing I just wanted to kind of point out, we have our auditors coming here the week of September 10th to do our annual financial audit and compliance audit. So they'll be here that week, and then we'll have get together with the budget on personnel committee sometime probably in late October, and then the audit report will be presented at the November meeting. So just kind of want to point that out. This quarterly report, just for your information, if anybody has any questions, I'll be glad to answer.
Are there any questions about that quarterly report? If not, it's for information only, no vote required, and that's good work. Thank you very much. I will say I'm in, I wish I had my local budget ready, and it came in 140%. Tell me what LUCA stands for, LUCA. Come on, y'all, we talking about this twice now. Local updated census address. All right, how did you go? Updated on that.
Thank you very much. So, just as Mr. said, the census, local update of census addresses, LUCA process is currently going on right now, and I'm happy to report that 24 of our 31 local government file submissions have been completed as of last week.
24, 31?
35. So we
You
can
gonna identify the?
No, so we've also been asked to assist with 24 of our local.
So you're at 100%?
Right ahead.
Hey!
The process is actually not over, even though we submitted it. It'll take about a year for the census to give us feedback. So about this time next year, we should get some feedback from the census and probably do some coordination with the census on that type of feedback. And at that point, then we'll destroy all the data and get rid of all the Luca reviewers and do all the work to kind of tidy up that process. But at this point, if there are any questions.
Interestingly enough, I asked y'all to please just think about your own city, county, this, that, and other, new apartment complexes that have come up, new subdivisions, and be sure and submit them. So, well, these are new addresses that are not available. How many new addresses have we tendered in to the census?
Yeah, that's a great question. 60,000?
No!
I was thinking it's closer to 100,000, just because in Houston County alone, it was about
These
35.
and that's not to say some old addresses gone now, houses burned down, ain't nobody there, but new addresses. I work on it. I know it. Take credit for that.
Sure.
100,000, everybody's working on 100,000, more than 60, and that's fantastic. Great job.
And then one other quick thing is that on our website, on our banner, the homepage, there's a link if you're curious about all of the different LUCA respondents, all the file submissions that the census has received. There's a map out there that the census created, so you can see the state of Georgia is pretty clearly blue, which is good. People are submitting it. The process is still, there's different deadlines for different cities and counties, but for the most part, our region, yeah, it's good. So.
Fantastic. Any questions, Michelle, about the LUCA and census update? If not, thank you very much, Michelle. That's one. Now, to start, Michelle, our executive director of the board, law.
I will tell you, this is what happens when you don't meet for a month. It went to 2 pages. Is it stormy outside? Am I raising this that? So first about, Abby, thank you so much for being here and the energy and sheer passion that you have for serving older adults is amazing. Comes out everything you do. And I will also tell you that the report on senior farmers market was not planned just because you were here. So good. Some of my things in here are not just because you're here, it'd be happening even if you weren't. But we're thrilled that you were able to join us tonight. Kevin Brown is not with us tonight. He wanted to make sure y'all knew that he had a command performance with his managing partner in Atlanta. He begged forgiveness and an excused absence, so we kept doing it. So lots of things have been going on over the last 6 weeks. I just wanted to give you sort of an update. First, I want to ask Matt if you'd like to come up. So you were envious of our budget status. Well, we actually received notice that we have for the 23rd consecutive year been recognized by the Government Finance Officers Association for a Certificate of Achievement in Excellence of Financial Reporting.
All right.
I really like about, so Matt, Garvin, and Crystal Vaughn, they are our finance team. Do all the heavy lifting of spending $13 million and accounting for every penny of it. But GFOA not only recognizes the organization as it's the organization's financial statements that get reviewed, but they also recognize the professional work of our staff. So I wanted to take the opportunity to recognize Matt and Crystal for their great work. Thank you very much. So as Matt mentioned, we're in the process of closing out. We spent a lot of time in July closing out FY18. Making sure we had our deliverables into the state, all of our reporting required, all of our contracts buttoned up, and also standing up FY19. I think we're headed in the right direction. We had a lot of stuff to turn in. With the transition of workforce development from the Department of Economic Development to the Technical College System of Georgia, we had a lot of changes that we had to deal with that we're still working through. And the Harmony system is trying to go live with financials, which is so much fun. So we're working through all of that. I appreciate the extension of time you've given us to do that. I did want to mention a couple of different activities. One is we have started discussions with Department of Human Services, DHS, about a pilot project to try and address a senior hunger and food desert problem. So one of the things that we have noticed, and actually DHS came to us and said, we really want to do this, we think we can fund it, is that our seniors will go from the senior center on a shopping trip, and then they get on the same van that they went on, but now they have bags of stuff, and how do they get their groceries home with them and all of that. So we're trying to figure out a way that we can actually fund the transport of groceries for seniors, and how do we make all of that work? And DHS actually paid for that, transportation of services, of groceries to seniors. And working with our senior center operators and companies like Walmart and Kroger, and how do we make all of that work in a safe environment? We want to start small with a pilot project in a county, and see if we can work out all of those kinks, and if we can, then, and it's successful and we have good data on it, DHS is very interested in moving that forward. We're in the early stages of those discussions, and look forward to seeing sort of how that evolves over the next couple of months. I will tell you, we've already picked where our pilot project would be, and that would actually be in Crawford County. And for one reason is it's fairly small. Second reason is they have a grocery store. They lost their
Piggly Wiggly.
and they actually have had to do some really creative things about getting groceries, fresh produce and things into their community as a result of that. So that's something that really resonated with, when DHS came to us with the project, they said, and we want to do it in Crawford County. We said, okay, great. But I think we might be able to work out a model there that is transferable. The State Association, Georgia Association of Regional Commissions, has a governing body that is made up of executive directors and a policy member. Mayor Wilson serves as a Middle Georgia representative on that policy board. We have just embarked on a strategic planning process. Had a facilitated almost full day session here last week, talking about sort of the future of regional commissions and the role of a state association of regional commissions, and how do we tell the story about the work that is being done locally in our own regions, but also at the state level to the General Assembly, but also other state agencies, new state agencies that we don't have a relationship with yet, or where we have an existing relationship, but we might be able to expand that. I thought it was a really great start of a conversation. We timed it in advance of the State Association's president, Jim Duff, who's the Northeast Georgia Regional Commission Director. He's actually presenting to the House Rural Development Committee next week about regional commissions and the work that we do and the services we provide. So it was, part of it was to give him some hot off the press things that are going on, but it's a larger initiative about the importance of regional commissions and how do we work more collectively as a state association. And I don't know if there's anything you wanted to add from that discussion. You're good?
Very good.
Great. So that process will continue. I would imagine probably at our November meeting, we might have some details that come out associated with that. I was able, fortunate enough, to travel with the group earlier this week out to Tinker Air Force Base for the change of command ceremony. General Lee Levy, who is the Air Force Sustainment Center commander, he's a 3-star, who's over the Air Logistics Complex, the biggest tenant of Robins Air Force Base, and Air Base Center. He's over that. He was retiring, and then also there was a change of command. And so we went with a group of 7 or 8 of us. Mayor Hurley accompanied, was on that trip, as well as Mayor Toms and some other community leaders. One of probably the most valuable part of that trip was we were able to spend about 45 minutes with General Polakowski. General Polakowski is the outgoing commander of the Air Force Material Command, which is the major command that Province falls under. She is retiring. In fact, she presided over the retirement ceremony, and it's her last official act as the commander of the AFNC. Well, what was really cool about it, other than the fact that she's this really neat chemical engineer, very super smart, is we got 45 minutes alone with her, and we already knew that this was happening, but we got an update. She's moving to Middle Georgia. In fact, she moved in last week. She actually has a daughter that works out at Robbins Air Force Base, and she's gonna split her time between here and Irvine, California, where her other daughter and her grandchildren reside. But to have that opportunity to have, I think, Chairman Stalnaker, I think this is the first time we've ever had that level in the region, I'm pretty sure. A four-star, retired four-star general, so great opportunity. I'm planning, we've already started scheming how to get her engaged in things in the region and just getting to know people in her new role. Hopefully she'll be ready to start venturing out sometime around our annual meeting and can come to a council meeting or something like that. We wanted to let you know about that. Two other things, three. First is, you'll recall last year we made some changes to our revolving loan fund programs and we dissolved Georgia Small Business Lender. And over this past year of 18, we worked through all of the mechanics of how does that really settle in terms of our loan programs. We have existing loans that we have continued to service, but we have not made any new loans, and we're ready to go through that process. And so over the course of the next month or so, we'll be convening an executive committee to work on new policies and procedures for how we make new loans without GSBL, and have been working very closely with the Economic Development Administration on what that looks like. So that's something that is, if you're on the executive committee, just know that Ken will be reaching out to you looking for availability over the next month or so. Last two things. One is, I've been working with a team of senior folks, funny enough, senior folks in our aging department, but seasoned employees in our aging program to sort of reimagine if we were starting an area on aging today, area agency on aging today, how would we organize it? How would it be, how can we best deliver all of the services that we provide? It's been a great collaborative process. It's been with a small group of staff. Next week, we roll out our wrap concepts to the whole aging team, because they're really smart and they may see something from a practical standpoint that's just we haven't thought of, or give us new ideas and information. I'm hoping to roll that out in earnest, hopefully by the first part of September. This sort of reimagining what aging looks like is caused by some changes in our funding stream. In one of our programs, we currently have 5 staff members who are providing services. We only have funding for 3 in that one program, but we have needs in other places, so we're trying to figure out how do we go about shifting folks around and getting the work done to continue providing quality services. So that's been going on. And lastly, you might have noticed, or perhaps you didn't, that this month's council meeting package did not include the 17-page report of staff activities. This is something that we've been looking at over the last couple of months, and I think I had mentioned that in a previous report, of trying to figure out, is that a useful tool for the council? How do we use it internally? How do we communicate what's going on? And the management team has been working with, we will continue preparing the report of staff activities, but instead of sending, that's available to you if you want. But we also think it might be better or more useful for you to get highlights and links to specific projects and what does that look like. And then one of the things that we will be doing is following the council meeting, we'll send out essentially a summary of the meeting, an executive director's report, so that folks who aren't here quickly know what was discussed. And then we will highlight projects throughout every month. And then we're also looking at doing something around a quarterly newsletter, electronic and printed if needed, but just to try and give good information that is easy to consume and useful to you as you make policy decisions that govern the regional commission, and making sure that, again, the level of interest and level of detail that you want to have is there. Certainly, if anybody has any input, we are open to it. We spent a good bit of time talking about how do we report out and usefulness of information and how we want to engage with you going forward. So I think that's it.
Any questions, Laura, about anything you said or anything going on? If not, Laura, thank you very much. We got several announcements. Next council meeting is September the 13th. Gosh, I can't believe it's already but the annual meeting I mentioned earlier will be October the 11th at Lake Tobosaki, and that's always a great social occasion, and we're looking forward to the annual meeting October the 11th. Now, the Georgia Association of Regional Commissions, which Laura mentioned earlier, their annual conference will be held on November the 7th through the 9th down in Savannah, but that conflicts with our meeting date. So because of that, we're shifting our meeting forward a week. So our November meeting will be in the first part of November rather than in the first Thursday, I think, in November rather than the second. So notice it to follow, but for advanced planning purposes, the November meeting will be in the first week of November rather than the second. November the 1st, I think, is the actual date of that. Any other announcements that we need to be aware of or need to make? If not, we've reached the end of our agenda. Can I get a motion to adjourn? And without objection.